This video tutorial is Stage 1 Meaningful Use with MyVision Express 2014. First, let's start with what meaningful use is, and then we'll go into the changes done with MyVision Express 2014. Meaningful use is best defined as demonstrating the use of certified EHR in ways that can be measured as being used in a meaningful way. This includes using e-Prescribe, using EHR technology for electronic exchange of health information, and to submit clinical quality and other measures. Meaningful use has 24 measures. There are 14 core measures and 10 menu measures. 7 require a yes or no, and 16 require a numerator and denominator. In addition, you must attest to 6 clinical quality measures. The reporting period for the first year is 90 days. Any subsequent years is the entire year. There are also exclusions that EPs are eligible for. For certain objectives, there are exclusions which allows the EP to basically skip that objective and they can move on to another one. As far as the incentive is 75% of Medicare Part B. The penalties are 1 to 3% from 2015 to 2017, 3 to 5% from 2018 to 2019. For Medicaid providers, there are no penalties. Incentive payments are a fixed amount each year and remain constant as long as you meet all the eligibility requirements for program participation. Now, who's eligible? For Medicare, doctors of optometry. For Medicaid, physicians, primary doctors of medicine. However, there are 5 states that now offer the Medicaid incentive to doctors of optometry. Those states are Alabama, Illinois, Kentucky, Ohio, and South Carolina. Now, in order to register and attest, you're going to go to the Medicare and Medicaid registration and attestation system. The link will be provided if you go to our Support Central page under Meaningful Use. What you'll need to register is an individual NPI number and user account with National Plan and Provider Enumeration System web user account. You must also enroll with PICOS. MyVision Express 2014 has introduced a few changes to make meaningful use easier and compliant to the 2013 changes. We have introduced physician setup so that each physician who will be attesting can choose which objectives they'll be attesting to. You're going to go to File, Setup, and Physician Resource In-House. This will take you to this page, and you'll be able to choose which meaningful use stage you'll be attesting to. And I'm going to choose Stage 1. You also have a Meaningful Use tab, which all 14 core will always be checked off since they are mandatory. You have the Menu sub-tab, which will allow you to choose 5 out of 10 menu objectives. Next, you have Clinical Quality Measures. The first 3 will always be checked off. Then you have your Alternate tab, which will allow you to choose 3 alternates, totaling in 6 clinical quality measures. I have chosen diabetes eye exam, primary open-angle glaucoma, and diabetic retinopathy since they relate to optometry or ophthalmology. Next, you have the Settings tab. This is new for 2014. You have certain exclusions that you can take for vital signs, either blood pressure, height, or weight. You can also choose the Stage 1 alternate. For CPOE, you may also choose a Stage 1 alternate. These, of course, will be discussed once we go into the objectives. Once you've chosen your meaningful use criteria, you're going to click Save. Now we're going to go into the 14 core objectives for meaningful use. The first core objective is CPOE, which stands for Computerized Provider Order Entry. Now, the objective is using computerized provider order entry for medication orders directly entered by any licensed healthcare professional who can enter orders into the medical record per state, local, and professional guidelines. The measure is more than 30% of all unique patients with at least one medication in their medication list seen by the EP and have at least one medication order entered using CPOE. Now, the alternative measure is more than 30% of medication orders created by the EP or authorized providers for all eligible hospitals, inpatient or emergency department during the EHR reporting period are recorded using CPOE. Now, as mentioned before, there are exclusions that apply to certain objectives, and there is an exclusion that applies to this objective. That exclusion is any EP who writes fewer than 100 prescriptions during the EHR reporting period. So in order to do this in MyVision Express, you're going to go to the Medications tab of the exam or even the patient profile. I'm going to go ahead and open up an examination and show you where to enter that information. I'm going to go to the Health tab. Now in the Health tab, you have your Medications tab. Form of entry. Now I'm going to move on to core objective number 2. Now core objective number 2 is drug interaction checks. The objective is if you implement drug-drug and drug allergy interaction checks, and the measure is if the EP has enabled this functionality for the entire EHR reporting period. Now this is done through e-Prescribe. Our vendor is Dr. First. Dr. First does implement drug-drug and drug allergy interaction checks. This objective is one of those yes or no objectives. So if you have enabled Dr. First throughout the entire reporting period, then you've satisfied this objective. Core objective number 3 is maintain a problem list. The objective is to maintain an up-to-date problem list of current and active diagnosis. The measure is for more than 80% of all unique patients seen by the EP have at least one entry or an indication that no problems are known for the patient recorded as structured data. I have an exam already open, and I'm going to go to the Health tab. I'm going to go to the Problems subtab, and from here you're either going to indicate one known problem. If not, then you're going to check off the No Known Problems checkbox. As you can see, this section is highlighted in a seafoam green color to indicate that it is related to meaningful use. Now in order to add a problem, you're just going to click on Add. It's going to have this problem list pop-up window, and this is going to allow you to search for the diagnosis. So if my patient reports that they are diabetic, you can just simply type in diabetes. It will generate a list containing diabetes, and then you can choose the appropriate one, highlight, and select. Core objective number 4 is e-Prescribing. The objective is if you generate and transmit permissible prescriptions electronically. The measure is for more than 40% of all permissible prescriptions written by the EP are transmitted electronically using a certified EHR technology. Now the exclusion of less than 100 prescriptions does apply. There is also an alternative exclusion. So if you have any EP who does not have a pharmacy within their organization, there are no pharmacies that accept electronic prescriptions within 10 miles of the EP's practice location at the start of the EP's reporting period, then you can take that exclusion. Now this is done through Dr. First. Once again, going into the examination, you're going to go to the Medications tab. In order to use e-Prescribe, you're going to click on the e-Prescribe button, which will take you to Dr. First. From here, you can enter the medication information and also electronically submit it to that patient's pharmacy. Core objective number 5 is active medication list. The objective is to maintain an active medication list. The measure is for more than 80% of all unique patients seen by the EP have at least one entry or an indication that the patient is not currently prescribed any medication recorded as structured data. So very similar to the problems list. Once I go into the medications subtab of the health tab in the examination, you have the no active medications checkbox available. It is highlighted in the seafoam green color, indicating that it's related to meaningful use. Now, if there is a medication to enter, you're just going to simply click on Add, and it's going to open up the RX terms code. From here, you can search for the medication that the patient is currently on. You can select it. And then if you're going to be prescribing the medication, then you can fill out the appropriate fields. Otherwise, if it's a prescription that you did not write, then you have the Outside RX checkbox available. You can fill out the RX pad information if the patient has that information available. However, if the patient does not have that information, then that's absolutely okay. If the patient doesn't even know what the medication name is, then that's fine as well. If my patient, let's say, is taking medications for blood pressure, but they're unsure of the name, it's absolutely okay to just write blood pressure medication. Core objective number 6 is active drug allergy list. The objective is to maintain an active medication allergy list. The measure is for more than 80% of all unique patients seen by the EP that have at least one entry or an indication that the patient has no known medication allergies recorded as structured data. Under the Allergies subtab of the Health tab in the examination, you once again have the checkbox No Known Medication Allergies available. It is highlighted in the seafoam green color to indicate that it is related to meaningful use. However, if the patient does have a drug allergy, you're going to click on Add. It's going to open up this line. Now you do have two allergy types. You have drug and you have other. Your other are for any seasonal allergies, allergies to shellfish, anything that's not a drug or medication allergy. To add that allergy, you're going to actually type that information on the bottom here. So for example, if my patient is allergic to penicillin, I can go ahead and type that in. On the bottom, you do have a Show All Reactions section, so you can actually choose multiple reactions and you can update it on the top. Now, if you have a patient who has no known drug allergies, but let's say that they're allergic to pollen and you still want to record that information, you're going to record that under Other. You can still type in the information on the bottom and also any reactions. Now you'll notice that although I did enter an allergy, this No Known Medication Allergies checkbox is still available. So remember that this objective is only looking at drug or medication allergies. So you would still have to check this off to indicate that there are no known medication allergies. Core objective number 7 is demographics. For the objective, it's recording all the following demographic information: preferred language, gender, race, ethnicity, and date of birth. The measure is for more than 50% of all unique patients seen by the EP have demographics recorded as structured data. This will be done in the patient profile. As you can see here, all those fields are highlighted in the seafoam green color, indicating it's related to meaningful use. So you'll enter your date of birth, your gender, your ethnicity, and also your race. Now, a change done with MyVision Express 2014 is now we have included the Decline to Specify option for both ethnicity and race. Core objective number 8 is Record Vital Signs. The objective is to record and chart changes in the following vital signs: height, weight, and blood pressure. It also asks to calculate and display body mass index and plot and display growth charts for children 3 to 20 years of age, including BMI. The measure is for more than 50% of all unique patients age 2 and over seen by the EP. Height, weight, and blood pressure are recorded in structured data. The new measure, which is optional in 2013 but will be required for 2014 and beyond, is for more than 50% of all unique patients seen by the EP during the EHR reporting period have blood pressure for patients age 3 and over only, and height and weight for all ages recorded as structured data. The exclusion is any EP who either sees no patients 2 years and older or believes that all 3 vital signs of height, weight, and blood pressure of their patients have no relevance to their scope of practice. There is a new exclusion which is optional in 2013 but will actually replace the exclusion mentioned before for 2014. The exclusion is any EP who sees no patients 3 years or older is excluded from recording blood pressure, believes that all 3 vital signs of height, weight, and blood pressure have no relevance to their scope of practice is excluded from recording them, believes that height and weight are relevant to their scope of practice, but blood pressure is not, is excluded from recording blood pressure, or believes that blood pressure is relevant to their scope of practice, but height and weight are not, is excluded from recording height and weight. In order to record this information, you're going to go to the Vital Signs sub-tab of the Health tab in the examination. You're going to click on Add, and all the fields that are related to meaningful use are highlighted in the seafoam green color. So you have blood pressure for systolic and diastolic, height, and weight. Now BMI is automatically calculated, and you do have the growth chart that's available here. The growth chart is broken down to 3 different chart types. You have weight for age, height for age, as well as BMI for age. Core objective number 9 is record smoking status. The objective is record smoking status for patients 13 years or older. The measure is for more than 50% of all unique patients 13 years and older seen by the EP have smoking status recorded as structured data. The exclusion is any EP who sees no patients 13 years and older. This objective is done through the patient profile. It's right above preferred language, or you can also record it in the examination under PFSH. Once again, it is highlighted in the seafoam green color to indicate that it's related to meaningful use. Core objective number 10 is clinical quality measures. The objective is to report ambulatory clinical quality measures to CMS. The measure is to successfully report to CMS ambulatory clinical quality measures selected by CMS in the manner specified by CMS. Now, clinical quality measures is now a separate objective for reporting ambulatory or hospital clinical quality measures as part of meaningful use. EPs, eligible hospitals, and CAHs will still be required to report on clinical quality measures in order to achieve meaningful use. CMS is removing the standalone objectives that require providers to attest that they plan to report clinical quality measures because it is redundant. Now, clinical quality measures branches off from 6 to 9 additional measures. You have your first 3 core clinical quality measures, which the first one is adult weight screening and follow-up. Then you have hypertension blood pressure measurement, and preventative care and screening measure pair, tobacco use assessment, and tobacco cessation intervention. Now with adult weight screening and follow-up, the percentage of patients aged 18 years and older with a calculated BMI in the past 6 months or during the current visit documented in the medical record, and if most BMI is outside parameters, a follow-up plan is documented. If you go to PFSH, you have counseling type that is documented here. If you are taking adult weight and the BMI is outside of norms, it will automatically calculate for the clinical quality measures report. For hypertension blood pressure measurement, the percentage of patients' visits for patients aged 18 years and older with a diagnosis of hypertension who have been seen for at least 2 office visits with blood pressure recorded. Now your denominator will be any patient who has the diagnosis of hypertension. Your numerator will be if they were seen twice in the reporting period. The last core clinical quality measure is preventative care and screening measure pair, tobacco use assessment, and tobacco cessation intervention. The percentage of patients aged 18 years and older who have been seen for at least 2 office visits who were queried about tobacco use 1 or more times within 24 months, and the percentage of patients aged 18 years and older identified as tobacco users. To indicate if they are a smoker, this is done through the PFSH tab or even the patient profile. Now, if they are a smoker, you have tobacco cessation under counseling and any counseling that was provided. Now, I mentioned before that it's 6 to 9 additional measures. If you get a 0 out of 0 in either one of your core measures, what the attestation will do, it will prompt you to choose alternative core clinical quality measures. Those 3 measures may be preventative care and screening, influenza immunization for patients, weight assessment and counseling for children and adolescents, and childhood immunization status. Since these 3 do not relate to optometry or ophthalmology, what happens usually is a 0 out of 0 is documented for all 3 alternative core clinical quality measures. This will not affect your attestation. There are no percentages tied to any one of these measures. Now, the last 4 that do relate to optometry are primary open-angle glaucoma, diabetic retinopathy, documentation of presence or absence of macular edema and level of severity of retinopathy. You have another measure for diabetic retinopathy, documentation of presence or absence of macular edema and level of severity of retinopathy, and diabetes eye exam. Out of these 4, you can only choose 3. Now, for primary open-angle glaucoma, the percentage of patients aged 18 years and older with a diagnosis of primary open-angle glaucoma who have been seen for at least 2 office visits within the last 12 months. For diabetic retinopathy, the percentage of patients aged 18 years and older with a diagnosis of diabetic retinopathy who have had a dilated macular or fundus exam performed during 1 or more visits within the last 12 months. The second diabetic retinopathy is the percentage of patients 18 years and older with a diagnosis of diabetic retinopathy who has had a dilated macular or fundus exam performed with documented communication to the physician during 1 or more office visits within the last 12 months. And the last is diabetes eye exam, percentages of patients 18 to 75 years of age with diabetes who've had an eye exam. The last 3 measures that relate to diabetic retinopathy or diabetes are looking for a diagnosis of diabetic retinopathy or any diagnosis that contains the words diabetes or diabetic in it. Now, this is recorded on the top of the examination under dilation by checking this off and clicking the stamp. This will trigger the numerator in the reports. Core number 11 is clinical decision support rules. The objective is implementing one clinical decision support rules relevant to specialty or high clinical priority along with the ability to track compliance with that rule. The measure is implementing one clinical decision support rule. This is done by going to File, Setup, exam, and alerts. Okay. To add a clinical decision support rules, you'll just click Add. On the bottom is your search criteria. So I'm actually going to use the example of glaucoma. My message, I'll say check IOP. And you can also choose an age range, an ethnicity, also a race. I'm just going to choose anyone over the age of 40. You can also have security groups, so I'm actually going to select everyone here. And then I'm going to click on Details. Now this Details is actually what's going to trigger this message that I just created. So I'm going to search for glaucoma. There we go. And I'll just click Close and Save. You only need one clinical decision support rules. This is another yes or no question, so simply having this set up will satisfy this objective. Core number 12 is electronic copy of health information. The objective is to provide patients with an electronic copy of health information, including diagnostic test results, problem list, medication allergies upon request. The measure is for more than 50% of all patients who request an electronic copy of their health information are provided within 3 business days. The exclusion is if any EP that has no requests from patients or their agents for an electronic copy of patient health information during the EHR reporting period. To satisfy this objective, you're going to go to the HL7 CCD CCR subtab of the Health tab in the exam. You're going to click on Clinical Summaries. A new change done with 2014. As I'm clicking Next, you'll see that problems, medication, allergy, laboratory test results, vital signs, any care plan, procedures, clinical instructions, diagnostic test pendings, future appointments, future scheduled tests, immunizations, administered medication, and chief complaint, as well as education provided, referrals, will actually be included in this new CCD. The clinical summary looks like this now. You can of course print it out, or you can just exit out, and that CCDA is now created. From here, if the patient requests this information, you're going to click on Upload, and this is going to send this file to the patient portal. That way they have access to this information. Core objective number 13 is clinical summaries. The objective is to provide clinical summaries for patients for each office visit. The measure is clinical summaries provided to patients for more than 50% of all office visits within 3 business days. The exclusion is if any EP who has no office visits during the EHR reporting period. There are several ways that you can achieve this objective. The first way would be done through the Letters module in the examination. Now, in the Letters module, you're going to go ahead and print out, or you can email any letter that says Exam Summary. Now, at the minimum, you need your problem list, medication list, allergy list as well. This is just an example of an exam summary that we have, but the letter must contain the words Exam Summary in it in order for it to count towards meaningful use. The second way would be done through the HL7 CCD CCR subtab of the Health tab. You can create a CCDA and you can print it out, or you can also upload to send it to the patient portal. If the patient does not want the exam summary, then you can always click on Declined and it'll count towards this objective. Core objective number 14 is Protect Electronic Health Information. The objective is to protect electronic health information created or maintained by the certified EHR technology through the implementation of appropriate technical capabilities. The measure is to conduct a review of security risk analysis in accordance with the requirements under 45 CFR 164.308A1 and implement security updates as necessary and correct identified security deficiencies as part of its risk management process. There are two ways that you can comply with this objective. The first way would be by contacting your regional extension center. You can either email them or you can call them and find out if they can do the risk analysis check and also how much it may be. Depending on each state and each regional extension center, the prices may vary. The second option would be through a documentation that we have created. It's a 39-page document. This documentation can be found under our Support Central page under Meaningful Use. The 39-page document will satisfy this objective. Now, you must be cautious to fill out the entire packet. If there are sections that do not apply to your office or you do not do, then you must provide documentation or a reason of why you don't do it in your office or why it doesn't apply. This is another yes or no question. When you attest, you'll say yes that it's been completed, but please do make sure that it has been completed either by your regional extension center or by completing the document that we have provided. In case of an audit, one of the things that they will be searching for or they will be asking for is the risk analysis. Now, those are our 14 core objectives. These, of course, are mandatory to complete. You can, of course, always take any exclusions that apply, and it will count towards meaningful use. Now, going to menu objective number 1, drug formulary checks. The objective is to implement drug formulary checks. The measure is the EP has enabled this functionality and has access to at least one internal or external formulary for the entire EHR reporting period. There is an exclusion that applies, so any EP who writes fewer than 100 prescriptions during the EHR reporting period. This is done through e-Prescribe. Once again, Dr. First does have the capability to perform drug formulary checks. Menu objective number 2 is clinical lab test results. The objective is to incorporate clinical lab test results into EHR as structured data. The measure is more than 40% of all clinical lab test results ordered by the EP during the EHR reporting period, whose results are either in a positive, negative, or numerical format or incorporated in certified EHR technology as structured data. The exclusion is if any EP who orders any lab tests whose results are either in a positive, negative, or numeric format during the EHR reporting period. In order to add laboratory tests and laboratory test results, this is done in the Health tab under Laboratory. You can add any tests that were ordered and you can record any results from here. This is an objective that most optometrists can take the exclusion for, since they will not be doing any laboratory tests, let alone receiving results. Menu objective number 3 is patient lists. The objective is to generate a list of patients by specific conditions to use for quality improvement, reduction of disparities, research, or outreach. The measure is if they generate at least one report listing patients of the EP with a specific condition. This is now done through File, Reports, Patients, and Patient List. This will allow you to choose an age range. I'm going to use the example of anyone from the age of 1 to 70. You can also do a date range. You also have your problem list here. So if I want to search for any patient who has a history of retinal detachment, I can search for that. And by clicking on search, it'll give me a list of patients who have the specific diagnosis. From here, you can go ahead and print, and you'll just save this documentation for your own records. This is going to be a yes or no question as well. Menu objective number 4 is patient reminders. The objective is to send reminders to patients per patient preference for preventative follow-up care. The measure is more than 20% of all patients 65 years or older, 5 years or younger, were sent an appropriate reminder during the EHR reporting period. The exclusion is any EP who has no patient 65 years and old, or 5 years or younger, with records maintained using certified EHR technology. Now, recalls are usually documented through the examination in the Assessment tab. It is highlighted here in the seafoam green color. The top one would be for any annual eye exams, and the bottom one would be for any follow-up recall reasons. Now, in order to generate those recalls, you're going to go to File and Letters. From here, you can search for the recall date range and recall to date range. By sending them either an email or printing out the list of patients and recalling them back, or also printing out labels to put on postcards, will satisfy this objective. Menu number 5 is Patients' Electronic Access. The objective is to provide patients with timely electronic access to their health information, including lab results, problem lists, medication lists, and allergies within 4 business days of the information being available to the EP. The measure is at least 10% of all unique patients seen by the EP are provided timely electronic access to their health information, subject to the EP's discretion to withhold certain information. Now, the exclusion is any EP that neither orders nor creates lab tests or information that would be contained in the problem list, medication allergy list during the EHR reporting period. This will be done in the Health tab under HL7 CCD CCR. For any patients that you would like to provide patient electronic access, you're going to go ahead and generate that clinical summary. Then you're going to click on Upload, so that way they have access to this information through the patient portal. Menu number 6 is Patient-Specific Education Resources. The objective is to use certified EHR technology to identify patient-specific education resources and provide those resources to the patient if appropriate. The measure is more than 10% of all unique patients seen by the EP who are provided patient-specific education resources. Now, there are several tabs that you can provide education. You have your Medications tab that has the Education button. Now, of course, this is done through Setup. You also have the Problem List, where you can add any education information. You also do have access to Medline Plus, and you can view educational material. The last tab is the Assessment tab. You have the Education checkbox available here, and you can indicate which education was provided. You can also indicate the delivery method as well, whether it was done through e-Prescribe, or if you printed something out, or if it was something done through a website. Once education has been provided, then the Education Provided checkbox is checked off. Menu number 7 is Medication Reconciliation. The objective is the EP who receives a patient from another setting of care or provider of care, or believes an encounter is relevant, should perform medication reconciliation. The measure is if the EP performs medication reconciliation for more than 50% of transition of care in which the patient is transitioned into the care of the EP. To do this, you're going to go to the patient profile. Now, under the patient profile, you're going to record the physician information under demographics if they were referred to your office. Then you're going to go to the Health tab, and you're going to go to the Medications. You're going to review their medication list and then you're going to click on Reviewed, which will date and time the last time the medication list was reviewed. Menu number 8 is Transition of Care Summary. The objective is the EP who transitions their patient to another setting of care or provider of care or refers their patient to another provider of care should provide summary care record for each transition of care or referral. The measure is the EP who transitions or refers their patient to another setting of care or provider of care provides a summary of care record for more than 50% of transitions of care and referrals. The exclusion is any EP who neither transfers a patient to another setting nor refers a patient to another provider during the EHR reporting period. This is done in the Assessment tab of the examination. If you are referring a patient out to another doctor, then you're going to go ahead and select the referred to and the reason. You're then going to go to the HL7 CCD CCR subtab of the Health tab. You're going to create a CCDA, and you can either upload to send it to the patient portal, or you can also print the CCDA. Menu number 9 is Immunization Registries Data Submission. The objective is the capability to submit electronic data to immunization registries or immunization information systems and actual submission according to applicable law and practice. The measure is performed at least one test of certified EHR technology's capacity to submit electronic data to immunization registries and follow-up submission if the test is successful, unless none of the immunization registries to which the EP submits such information has the capacity to receive the information electronically. Now, the exclusion, which will apply to all ophthalmology and optometrists, is an EP who administers no immunizations during the EHR reporting period or where no immunization registry has the capacity to receive the information electronically. Menu number 10 is Syndromic Surveillance Data Submission. The objective is the capability to submit electronic syndromic surveillance data to public health agencies and actual submission according to applicable law and practice. The measure is perform at least one test of certified EHR technology's capacity to provide electronic syndromic surveillance data to public health agencies and follow-up submission if the test is successful, unless none of public health agencies to which an EP submits such information has the capacity to receive the information electronically. The exclusion is an EP who does not collect any reportable syndromic information on their patients during the EHR reporting period or does not submit such information to any public health agency that has the capacity to receive the information electronically. To do this, you're going to go to File, Reports, Patients, and Syndromic Surveillance. From here, you can search for any date range, and you can enter the ICD code. Then you're going to search, and it'll generate a list of those patients. Now, those are all 24 objectives. In each exam, you have a meaningful use checklist found on the top right icon. This checklist is going to display all the objectives that you will be attesting to. It'll display all your core objectives as well as your menu objectives. It'll show you if you have passed any objectives or failed any objectives. This will give you the opportunity to fix that information while you're still in the exam. For any contact lens checks, RX checks, you do have an exclude for meaningful use checkbox. This will exclude any follow-up visits like contact lens checks or RX checks from meaningful use. You also have the Meaningful Use Report, which is found under File, Reports, and Meaningful Use. You have all your core that are checked off. You have your menu items that you can choose, clinical quality measures for both core and alternates. You can also choose which stage you're doing, whether it's stage 1 or 2. the physician who's attesting, and your date range. You're going to click on Run, and it's going to generate the report on the bottom of the screen. Now you have two rows that are available. The attestation row are for your yes or no questions. So for example, core objective number 2, drug interaction checks. If you have enabled e-Prescribe throughout the entire reporting period, you're going to check this off, and it's going to ask if you've met those requirements. You'll say yes, and that way that red X goes away and a green check mark takes its place. You have the exclude row, so for any objectives that you are excluding yourself from, and you can simply check that exclude checkbox. On the top, you have the history button, which will generate and show you any reports that were created for meaningful use. You have the current location checkbox, so if you have multiple locations and you only want to view this location's meaningful use criteria, then you can check this off and run the report. On the bottom, you have a filter feature, so you can filter between any pass or failed objectives. You have the export button, which will export this information onto an Excel sheet. You have the explanations button, which will show you any objectives that you did not satisfy. Also, any patients or exams of which a certain objective was not satisfied. So for example, I can see here for this patient, I did not enter vital signs. It will also instruct you on how to complete that objective for that particular patient or exam. The last button is the print button, which will allow you to print out the meaningful use report. And that's it for Meaningful Use Stage 1 in MyVision Express 2014. Please visit our Support Central to view more video tutorials and how-to guides in our knowledge base. It's under support.myvisionexpress.com. Thank you for choosing MyVision Express to accelerate your practice.